Today we're going to talk about the next big European regulation that is coming very soon into force, the Artificial Intelligence Act, and we will see how it will affect the life sciences sector. So we will present some interesting use cases related to the sector, and we will show you what you can do in practice to align with the principles and requirements of the AI Act. Please feel free to send your questions in the chat, and we'll have a Q&A session at the end of the presentation. So before starting, we are an IPP Gold member, and you can claim 0.5 CPE points by attending this webinar. So first of all, to give some context about the AI Act, let's start by looking back at the history of artificial intelligence. As you may know, artificial intelligence is not a new technology. It has existed since the 1950s, and what has changed, or rather accelerated recently, is the increasing capabilities and widespread availability of those technologies, such as ChatGPT. And this has been made possible by data becoming available at a very large scale by big corporations. So in parallel to the development of those technologies, there have been numerous initiatives to regulate and frame their use, such as ISO standards regarding artificial intelligence, the framework for machine learning, such as the NIST AI framework. There have also been guidelines published by data protection authorities, such as the CNIL in France or the ICO in the United Kingdom. There has been OECD principles. And also, a thing to note is that regulators have also been quite active in the US with the executive order about AI that has been published by President Biden at the end of last year. And also, just recently last week, the AI bill published by the state of Virginia. And the AI Act comes in this general context of regulations. And it's a bit special because it's the first widespread, cross-sector widespread piece of legislation that is quite comprehensive to frame AI systems. So now we see what is the timeline about this AI Act. So this law has been under discussion for several years. It has been approved by the European Parliament on March 2024, after the last decision made at the end of last year. And it will enter into force very soon. It's pending, but expected to be very soon. And it will be enforced 20 days after publications. But as we can see here, there will be a gradual application depending on the types of AI. So even if there's a transition period, the European Commission highly encourages companies to start to be compliant and to put in place the requirements of transparency, of everything, even before it becomes like too late for you. And all of this will be accompanied by the AI Office, which is a body that was created in early 2024, and that will accompany the implementation and the enforcement of this, and may be able to apply fines. And it will be accompanied by national bodies as well. So now let's see what the AI Act is about. And first, which AI systems fall under the scope of the AI Act. So the definition is quite broad. So an AI system is a machine-based system that is designed to operate with varying levels of autonomy and that may exhibit adaptiveness after deployments, and that, for explicit or implicit objectives, infers from the input it receives how to generate outputs such as predictions, content, recommendations, or decisions that can influence physical and virtual environments. So we can see here that the AI Act is not targeting specific technologies, specific AI systems, but we will see just after that it will differentiate those systems based on their risk classification rather than on their core technology. So now regarding to whom the AI Act will apply, of course it applies to people and companies based in the EU, but similarly to the GDPR and other extraterrestrial laws, it may apply to people or companies based outside of the EU. So for instance, a provider of an AI system, we'll see just after what is a provider, if they put on the market or put into service an AI system in Europe, or if the output is used in Europe, will be under the scope of the AI Act. And the deployer, even based outside of the EU, if the output of the system is used in the EU, will also be under the scope of the AI Act. So there are a few exceptions to this law, such as non-professional use, open source systems, and systems that are developed solely for the purposes of research and development. So as of today, it is not completely clear which research and development fall under this scope, and further guidance is expected from the authorities to clarify this point. But you can keep in mind that this general idea to still be as compliant as possible and follow frameworks in general, and really to be proactive and not to wait for the law to apply to you.
There are two main factors to determine the requirements of a given AI systems. First, the role of the organization in the value chain, and secondly, the level of risk according to the categorization in the AI Act. Regarding the risk classification, we can look at different tiers. Firstly, the prohibited uses of AI systems. As examples, we can mention social scoring, also uses that may exploit vulnerable people or groups. For example, this could be patients, and that may cause significant risk. Also, systems that use biometric characterization in order to infer the race, sexual orientation, or religious beliefs of persons. And we also can find, in the second place, high-risk AI systems. Two types. First, we have products or safety components of products that are subject to third-party conformity assessment according to harmonized legislation. This could be, for example, the medical device regulation or the in vitro medical device regulation. In the case of medical devices, for example, medical devices that are not class 1 would be included in this category. Then we have the systems that are listed in Annex 3 according to the different sectors of deployment. We have, for example, use in law enforcement, administration of justice, but others that can be interesting would be the workplace, for example, recruitment, systems that implement targeted job offers, systems that monitor the workers or used for deciding which worker to promote, for example. And also we can mention the case of the emergency triage in a hospital. This could be also a case of high-risk AI system. These systems are subject to different requirements in terms of risk management, quality of the data, and also fundamental rights impact assessment in the case of some deployers, not all. An example would be a hospital, even if private. This hospital would be performing healthcare, and so it will be providing a public service, and they will need to perform a fundamental rights impact assessment, also robustness, cybersecurity, or documentation and record keeping. There is an exception for the systems in Annex 3 if they are not likely to cause significant harm for health, safety, and fundamental rights. They can be excluded from this category of high-risk AI system, but in this case, the company would need to perform the evaluation and to document why they think that this is not a high-risk AI system. As examples that the law provides would be cases in which the system only provides like a narrow procedural task. For example, if you take a medical device as an unstructured data set, transforming it to a structured data set. Then we have limited risk AI systems. These will be systems not included in the previous categories, but they are in direct contact and interaction with humans. For example, chatbots. Also, systems that manipulate images or audio or video. This is the case of deepfakes. And also generative or general purpose AI systems that create content, synthetic content. These systems are subject mainly to transparency and documentation obligations. There are also the specific case of general purpose AI systems that are subject to specific requirements in the AI Act related to transparency, information, documentation, but also other related, for example, to the quality of the data. And also if the system is considered as causing systemic risk, then additional requirements apply. And finally, we have minimal risk system, other systems not included in the previous categories that are not subject to requirements according to AI Act, but still it will be a good practice to perform the evaluation of the risk and to document it to highlight that this is a minimal risk assessment and probably align with the more important principles of the Act.
So now, once you have identified the risk of your AI system, the next important thing to identify is the role of your organization regarding this AI system, because it will change the requirements that you need to put in place. So you could be the provider if you are the entity that is developing the AI system and puts it into service on the market under your own name. So as we mentioned before, even if you're a provider based in the US, if you put it on the market or if the output of the system is used in the EU, then you would be under the scope. The other most important role is the deployer, so that would be the company that is using the AI system under its own authority in a professional context. So it would also apply to a deployer based in the US if the output of the system is used in the EU. So those are the two main roles to focus on. And then you also have the importer, which is the company which puts it on the EU market under the provider's name, so based in the EU. The distributor would be the company that makes it available on the EU market without being the provider or the importer. And finally, if you have a provider based outside of the EU, they would need to designate an authorized representative in the EU to take care of their requirements. And all those roles are operators of the AI system. So now we will see how it will affect your organization in practice through a few practical cases with different level of risk and different roles. So first of all, let's take the case of a US company which is developing a medical device software that assists personalized treatment decisions. So this is the context of personalized medicine. And they use it in partnership with a US sponsor who is performing a clinical trial in the EU. So let's see what are the roles and obligations in that case.
In this case, this would be a high-risk AI system because it's a medical device that under the medical device regulation has to be subject to a third-party conformity assessment by a notified body. Then the role of the US company developing the system would be provider of the AI system, and this would be provider would be under the scope of the AI Act because even if the provider is outside of the EU, the system is put in the market in the EU. So this is an example of the extraterritorial effect of the AI Act, which is very important. And regarding the obligations, there are several obligations for the provider besides the conformity assessment, a risk management system in order to detect, evaluate the risk for health, safety, fundamental rights according to the intended purpose and the instructions of use, and also the adoption of mitigating actions, and the objective is to have a residual risk that is acceptable. Also requirements in terms of quality of the data for testing, training and validation, to avoid biases, and also it's important to highlight that we still need to comply with GDPR because the personal data is involved. And quality management systems also. And it's important also the transparency and human oversight obligations. The system has to be designed in a way that can be subject to human oversight, and the deployer is able to understand the output of the system, detect anomalies, and more importantly, the provider has to give the deployer the instructions of use. There are also documentation and record-keeping obligations, and the system is necessary that the system keep logs during all the life cycle. Then for post-marketing vigilance in case of risk or serious incidents, and of course the authorized representative in the EU.
So now let's see what happens for the other US company in this case, the company which is conducting the clinical trial in the EU, so the sponsor of the study, and who is the user of this medical device software.
Mm-hmm. In this case, as in the previous slide, is a high-risk system. The role would be the deployer because they are using the system under their authority. The scope is within the AI Act, of course, because the US company performing the clinical trial is in the US, but the output of the system is being used in the EU. And also regarding the obligations, we can say that the deployer does not have as much obligations as the provider, but it still has to implement technical and organizational measures, ensure that the data that is fed to the system is relevant and accurate, assign the human oversight to specific individuals within the organization, and these individuals have to be trained and have the appropriate resources. Information to the individual subject to this AI system, to the representative of the workers, for example, to patients, data protection impact assessment according to the GDPR because personal data is involved, log keeping, normally 6 months, monitoring of the system to, for example, stop the use if necessary or report any risk of or incident, and have also to do their due diligence regarding the obligations of the provider in terms of, for example, vendor assessment, drafting of the contracts, and put in place appropriate clauses to protect the organization.
So then let's take another case of here again a US sponsor who is conducting a clinical trial in the EU and who uses a generative AI system to help them design the protocol. So it's based on synthetic data, but it will help them to select the sites, it will help them maybe to decide which treatment to administer, which doses, etc.
Mm-hmm. In the case regarding the classification, it's a limited risk system, but it's a general purpose system that is generating this content that is synthetic, for example, text or image or video. The role would be obviously the deployer because they are using the system, and this is also under the scope of the AI Act because the deployer is in the US, but the output of the system is being used in the EU. For the obligations, even if the deployer may have some transparency obligation, I think it's important to highlight the due diligence in regards to the obligations of the provider, mainly the technical documentation, the information obligations of the provider, meaning the provider needs to inform the deployer about how to use the system in order to do it according to the instructions of use, implementing a copyright policy, training also made public the content that is used for training. They need to be transparent about the fact that the content is AI generated and inform also the subjects affected, and implement the necessary and feasible technical solutions.
So now we'll summarize with all those cases we saw a bit in practice, depending on the role, on the risk level, what you needed to do. Now we'll summarize about what you need to do to get started. So we have seen those different requirements, and now let's see how do you do it, how to operationalize them to ensure a responsible use of AI within your organization. So you could take a multidisciplinary approach, involve all your departments, and the first step is to do the mapping of your AI. So really to know who is using AI, for which purposes, with which limitations, because some uses may be obvious, but others not so much. So you might have someone in the marketing department using AI to generate like a presentation for investors. So yeah, really to investigate about that. Also, maybe an important point is it's not only internal to your organization, but look at what happens with your vendors and service providers, because the vendors' products may involve AI without it being obvious. So, for instance, software you're helping select the sites of a clinical trial. So you can take this into account during your first contact, include it in your vendor assessment. Also think about including clauses in the contracts to protect you in terms of liability, intellectual property, etc. So then you need to identify the risk and the role of your organization to know what you need to put in place. So you may need to perform a fundamental rights impact assessment that we mentioned, or data protection impact assessments. Also, don't forget that there's risk regarding the AI Act, but you might have other legislations applying. So you could have also GDPR risk, or linked to medical devices, or linked to other regulations. And then, of course, you would put in place mitigating measures to limit the risks of this AI system. So an important point would be to raise awareness, to train your employees about the responsible use of AI. Of course, it will also include documenting, putting in place policies and procedures about how to use AI, with which limitations, how also to monitor the mistakes your AI system may make, about bias and discrimination, which is a big topic. You need to be able to monitor that and have a process to limit that. Then you need to accept if the residual risk is acceptable for your organization to continue towards the implementation, where this is when you would be using the AI system or putting it on the market. And the important thing is to monitor this closely, regularly, to continue identifying typically biases, and so it's an ongoing quality process. So in conclusion, we have seen the different requirements that you may need to put in place regarding the AI Act. Some interpretations are still not clear, and we are waiting for further guidance from the authorities, but this should not stop you from starting to implement things right now and to start this process of at least knowing if AI is happening, because it probably is, even if sometimes it's not officially known, yes, let's say. So yeah, thank you, Noé, for this analysis.
And thank you, Virginie, and thank you all the attendants. Don't forget that you can follow us on LinkedIn. And also, if you have any question or you need guidance about the AI Act in the life sciences or data protection, you can email us.
And the email should appear on your screen. So now we have a time for a few questions. We have a first one. If the output is used but the input is not from EU data subjects, is the AI Act still applicable? And does the nature of the output have to be taken into consideration of that case?
No, in that case, the AI Act still would be applicable. Even we have to take into consideration that you don't even need personal data for the AI Act to apply first, and then that it does not matter that it's developed in the use. For example, the important part is that it's put on the market or the output is used in the EU, because it's going to affect anyway to EU citizens.
Yeah. A good question, but yeah, the scope of application is very broad. That's for sure.
Yes.
And so then we have another question. How can a company demonstrate their compliance?
Yeah, it's not easy to demonstrate compliance, and right now we have very vague concepts like accuracy, robustness, and yeah, it's difficult to demonstrate. At least the drafters have keep that in mind, and we will have implementation acts from the European Commission, and we will have also harmonized standards, and some of them may be simply adopting the international standards that we already know, like the ISO, and also the European Commission wants to support the implementation of codes of practice, and this would help you demonstrate your compliance, and of course always documenting everything.
I see also the question, what would you identify as a principal risk for life science company not following the rules of the AI Act?
Oh, that's a difficult one. There are a lot of risks, I think, and I think it's important to mention that in the life science sector, we are dealing with vulnerable people, and this is, I think, something to keep in mind. And the possible repercussions can be really life-changing. So I think this is, for me, the most
important point. Yeah, so maybe mainly reputation and trust for the company, because then people then will refuse to use the system, and you will have other issues. And of course, their fines are part of the AI Act and will be implemented. Mm-hmm. And we have another question. Is there any measures in the AI Act to help companies to boost innovation?
There is mainly one. It's the AI sandbox. It's like control environment where companies can explore how they use their AI system. They can document the use. They can receive a report about the use, and is supposed to help and make easier and faster to get approval. But we will see about that. But this point has been criticized, the fact that there are not a lot of measures to boost innovation.
Yeah, but I think also the intent of the Commission is not to block innovation. They want AI innovation to happen in Europe, but they also want to regulate it. But it's all a balance, and so they're willing to communicate with companies and to find solutions together, and also with the authorities, national authorities, which some are more active than others. And the CNIL probably has already published a few guidelines and is really proactive to build together this trust and this responsible use of AI. We have another question. In your view, what is the biggest difference in terms of obligations between the development and the use of a classical health app and an AI-based one?
Oh, wow. I mean, this would depend on the purpose of the app, right? Because this is a very general question. AI health app could be something that is minimal risk. If it's not minimal risk, limited risk, maybe because it's interacting with a human, with the user of the health app, but we don't know. It depends, because it could be also an app used for assistant with the treatment, so the requirements would be bigger. So we would need to take into consideration the level of risk.
Okay, I don't think if we have any more questions. I think there was one about ChatGPT. Yeah, so what do you need to do if we think that people in a company are already using ChatGPT without telling the data protection officer or the AI officer?
Yeah, this is obviously something that you already mentioned, but it's important to already take steps, identify the use, the purposes, document it, and create policies and procedures for this use, and say when you can use it, for what purposes. For example, there may be repercussions in terms of data protection, but also confidentiality or intellectual property if you are using data that is owned by the company. So I think that's the most important points.
Yeah, so it goes back to awareness, to know like how the technology functions, to know what are the effects.
I think that's
like
the
if
most
you input
important.
something in ChatGPT, it doesn't just disappear. It gets somewhere, and it could be your company data.
Yes.
So I think we can wrap this session. Thank you very much for attending this LinkedIn Live. We want to announce you that there will be a US Data Privacy for Health Summit organized by MyData-TRUST on September 10th in North Carolina, in Raleigh. And you can get a 20% discount code that should appear on the screen, or you can ask our marketing team. So thank you again, and see you during our next LinkedIn Live. Bye.